When I was introduced to the Percocets is when it was like, it became a problem and I couldn't function without. And then so that only lasted a couple months, and that turned into using Oxy 80s. And then once those were all gone and too difficult to find, you know, the only alternative is to go and get heroin.
So some of the things that stand out to me about Joe's experience that are striking are, I just love the fact that he was so motivated that he was going to spend 2 days and nights in our parking lot waiting for us to show up. I think not a lot of people would have done that. They would have gone somewhere else and probably would have lost them to follow-up, because during that period they would have relapsed, almost certainly.
I wanted it so bad that I was, you know, willing to sleep in the doctor's parking lot for a couple of days just so I could get in to see the doctor. So for me, I didn't have any nerves about it. I just knew that I wanted to give it a try because I had tried everything else.
So his story then goes on to talk about like what treatment looked like and how it was this never-ending cycle of treatment program, abstinence-based treatment, relapse, having a hard time maintaining sobriety, and just this constant battle and struggle that goes on and on and on, and how hard it is and how it makes it hard to do anything but those things when you're trying to maintain your sobriety. Like the idea of getting a job and stable housing and mending relationships, and these things are almost like, they seem like impossible when it's taking all of your energy just to stay sober from 1 hour to the next.
I would just get so much anxiety to the point where I just kind of wanted to take off and run, really. And I guess it's just, you feel super stuck in those situations because everything is so focused on just one thing, you know, this staying sober. And for me, it just got to the point where I would just be thinking about it for long enough and have enough. And I wanted to get better, so the stress of like wanting to like leave and have everything figured out and have my own place and have a life would, and then when you feel like that you're not getting that or you're not going anywhere, then that's when I decide I'm just gonna change my situation real quick and go use, even though it's for the, you know, probably not for the better.
Joe was one of our first Sublocade patients. I knew that injectable buprenorphine was going to have tremendous upside, but probably the single biggest reason is the daily decision making. When patients are on sublingual buprenorphine and they have to decide, you know, twice a day whether to take it or not take it, whether to take it or, you know, go get high instead, I mean, many of them experience what's called decision fatigue, where after a period of time, it's just, they just can't, like, it's just too much and they just stop taking it. And that's oftentimes when they relapse. And so what injectable buprenorphine does is effectively takes that entirely off the table. They only have to decide once a month, one decision, whether I'm going to get my next month's shot. And the shot is so effective because it has a high enough blood level of buprenorphine that it takes away all the cravings, and there is no sort of daily cycling, you know, between doses. And so it gives him the time to focus on all the other things in life that he needs to focus on to be productive and move forward. Life is
really good now. I have like peace of mind and stability, and that's something that I've always been like looking for, is just be able to take care of myself and be a stable individual. I guess I can think clear, honestly. I know it might not, you know, that might sound weird, but because I'm not thinking about all these other things and cravings and trying, you know, like bouncing back and forth in my head if I'm gonna, you know, what'll happen if I use or not. Like, there's just, I'm not gonna use. It's just, I don't even think about it. So
I think if I'm forced to pick just one takeaway from Joe's story, is that you should be open-minded to learning about and potentially trying all the options that are available. And if you've tried everything else and it hasn't worked for you, and there's this one thing called buprenorphine or injectable buprenorphine that you haven't tried, then you should try it. It could change your life like it changed Joe's life.